Hi friends, today we will be discussing about the epilepsy. So what is epilepsy? So epilepsy is a type of brain disorder. First we have to consider that it is a type of brain disorder in which the person is having repeated seizures. In which the neuronal activity in the brains which having the neurons, billion of neurons, signal abnormally. Signals abnormally. So which causes loss of consciousness, sometimes muscle spasms, muscle twitching, etc. Here now we will focus on the neurons, also called as the nerve cells. There are two types of nerve cells. First one is the excitatory neurons and second one is the inhibitory neurons. So excitatory neurons, what does? It causes other neurons to fire action potential through chemical messages. It is also called as the neurotransmitter. And what inhibitory neurons do? They suppress this process. Now we will focus on the types of seizures. So the seizures which are occurring in the specific or the limited part of the brain, as it is shown over here in the frontal lobe, it is called as the partial seizures. And the seizures which involve the whole brain, it is called as the generalized seizures. Focus on the partial seizures, which is also called as the focal seizures. The first one is a simple partial seizures, in which there is the jerky movements or in this seizures the patient may have jerky movements and person is aware in this seizures, whereas in complex partial seizures there is a chance of loss of consciousness. So according to the behavior of the patient we categorize the seizures. So now we will focus on the generalized seizures. The first one is the absence seizures, which occurs in children, in which there is a brief loss of consciousness. The second one is the tonic seizures, which causes the stiffening of the muscles, and the persons fall backwards. Now we will focus on the atonic seizures, in which there is the stiffening of the muscles, in which the twitching of the muscles also occurs and the person collapse involuntarily. Now we will focus on the clonic seizures, in which there is a twitching of the or the spasms of the muscles of the neck, face, arms and legs. Now we will focus on the myoclonic seizures, in which the twitching of the muscles occurs, and last one is the tonic clonic seizures. It is also called as convulsive seizures, which causes loss of consciousness and the loss of movements, which requires the immediate medical treatment, and it also causes the loss of bladder control also. झालं होतं. Now we will focus on the causes of the epilepsy. The first one is the injury. What injury causes? It causes the specific area of the brain to excite more. The second one is the tumor, any brain tumor. The stroke, which is also called as the transient ischemic attack. The infection, which is maybe the meningitis. The defects such as autism and Down syndrome. The furthers are overdoses of antidepressants and some genetic causes. These are the causes, some of the causes of the epilepsies. Now we will focus on the diagnosis of the epilepsy. The first one is the neurological or the behavioral exam, in which the symptoms are tested. The second one is the blood test. The third one is the electroencephalogram, also called as the EEG. The fourth one is the CT scan. The fifth one is the MRI, and the sixth ones are the neuropsychological test, in which the person's behavior are examined through the different tests. Now we will focus on the treatments of the epilepsy. At present there is no cure for epilepsy, but the medications are taken to decrease the amount or the intensity of the epilepsy. Certain medications such as anticonvulsants are taken or the prescribed to the physician according to the age, lifestyles, and all the other important things. The second one is the ketogenic diet, which is mostly used in the children to decrease the intensity of epilepsy. The third one is the vagus nerve stimulation. The vagus nerve is stimulated in this process. The last one is the surgery. In surgery, the affected part which is of not use, the affected part through which the epilepsy is generated or the seizures are generated, which is not used by the brain, is removed through the surgery. Thank you.